All right, guys. Just taking a little quick rest between laps here. We're in sunny Utah and having some fun with my family, but my team asked me to give these questions a little answer. So somebody had asked a question about one of the cases, in the fact that it was a class 3 case and it was 11 years old and had still a decent amount of growth potential, and was curious if I wanted to use any sort of growth modification plates or anything that could potentially overcorrect and maybe help me out long term. Well, one of the things that was interesting about that case is that most of the ones that I showed in ultimate fundamentals were all some sort of pseudo class 3. None of them really had a true class 3 growth pattern, right? Like, you look at the Wits appraisal, maybe -2, -3, but all of them had a functional shift anteriorly. So in this particular case, I could get the kid kind of end on. The only issue is that he had so much over-eruption of lower incisors that, it was going to take a little bit to collect all that space and jump the bite. So, I knew once I treated him that he would be fine and I wouldn't really have any issues. We do monitor our cases for 8 weeks and then 12 months and then another 2 before. So if we had an issue, we could always add some buttons to his elastics retainer and have him wear some nighttime elastics. But I try to keep things simple. I know there's a whole bunch of techniques out there that you can use on an individual basis, but we have pretty scaled practice, and I try to keep things consistent, easy for my team. And in this case, it worked out. So hopefully that answers the question. Bye.